Good morning and welcome to our discussion on mental health in the midst of COVID-19. My name is Christina and I am part of the All of Us team here at the University of Miami. The All of Us research program from the National Institutes of Health, also known as NIH, is a national effort to help build one of the most diverse health databases in history. Researchers will use data to learn how our biology, lifestyle, and environment affect our health. We're all unique, we're all different, so researchers are hoping to use this data to help receive better treatments and ways to prevent different diseases. So today we're honored to be partnering with the City of Sunny Isles Beach to help bring awareness around the topic of mental health, especially during the holidays. 2020. Just leave it there for a second to marinate. It's been quite a year, has it not? So we can all agree that I think it's time to be over and go into 2021. And during this time, mental health has become so imperative, so important. And I think it's very important for us to realize that it's just as important as our physical health. So today we're honored to be also here with our guest speaker, Dr. Carrasquillo, who is one of the principal investigators for the All of Us research program at the University of Miami, and is also the chief of the Division of General Internal Medicine at University of Miami. So Dr. Carrasquillo has been on the front lines with UHealth during this pandemic, and he has been amazing with helping his team of medical professionals stay positive during this time. He is currently also working on COVID-19 vaccine trials with Johnson & Johnson amongst all his other duties. So he's very, very busy. So before I jump in, I would also like to give the team from Sunny Isles the opportunity to introduce themselves to describe their roles within the city. So Nick, kick her off.
Hi guys, my name is Nick. I'm the athletics program coordinator here with the City of Sunny Isles Beach.
Hi everybody, I am Silvia Flores. I'm the director of our Cultural and Community Services Department. And our department focuses on a lot of the frontline services like recreation, athletics, special events, parks, maintenance, all of those things that we're hoping that you're utilizing to stay healthy mentally and physically.
Fantastic. Thanks, guys. So again, we want to thank your team for partnering with us and help bring awareness on this very important topic. So let's jump right in. I think Dr. Carrasquillo, why don't we start off with you kind of giving us an update and the status of COVID-19 in the Miami-Dade surrounding area. I think that's a great kind of place to start here.
Again, thank you. And thank you so much, Christina, for putting this on. And really thank you to the City of Sunny Isles, Nick and Christine. I think these are critically important, especially during this time, to keep our community informed and, to let everyone else know about the mental health, but also other aspects of the epidemic. We here at the University of Miami, obviously, we're doing a lot of important research, all of us as one example. But during this time of COVID, obviously, this is a major unprecedented public health crisis. And we've really tried to pivot and address a lot of these community concerns and, serve as trusted sources of information for a lot of these issues. So thank you very much to the City of Sunny Isles for doing this very important community service. Unfortunately, with COVID, it's one of these things where we're at one of our darkest times, but also one of the most positive times. And I think we're really excited being at this unique time. Certainly, I'm a lot more optimistic than we were, several months ago. I think in April, when we first had, the first wave of the epidemic, it was a lot of things we didn't know. And it was very scary. And I think, a lot of the immediate public health things that were implemented needed to be done, but they've also caused a lot of these mental health effects that have resulted from it. Critically important, then we kind of let our guard down in June when we thought it was over. And then we saw, obviously in July, tremendously devastating impact. And it was really sad. We got hit really hard in Florida back then. And then we got over that. A lot of it was through the social isolation measures, which, had positive but negative impacts. And then again, in September, we let our guard down and now we're back to another crisis again. So it's been very cyclical. So I can totally see how people are really devastated about this. the one good thing, I think the one ray of light, and I'm really willing to take questions that we have now, is that unlike before, now we kind of see light at the end of the tunnel. Today, I haven't checked my phone yet to see where we are with emergency authorization, but we have some of the vaccines that many of us have been working on here and across the nation and in the world to get emergency use authorization. But we do have some light at the end of the tunnel. The holidays are going to be extremely difficult. These vaccines are not going to help us through the holidays. Clearly, we're still going to have to do a lot of the social isolation, and the holidays are always, for mental health crisis perspective, really challenging for people, particularly those that are isolated. And unfortunately, we're going to have a few more months before the vaccines start really, kicking in. We get the whole population being vaccinated. But at least now we do see light at the end of the tunnel, so I could at least give a much more optimistic message than I could a few months ago. So, and with that, we'll open it up. But, I think we're even though we're really, really bad place in terms of numbers and cases, we at least see the path out of this.
Yeah, absolutely. And thank you so much for providing that update. Now, going into another question here, we hear so much in the media and we hear so much on social media and things being shared and, through the grapevine and all this kind of stuff. I think it's very important if you could kind of help debunk some of these myths to ease the minds of our listeners. So if you don't mind telling us what are some of the stigmas and rumors surrounding COVID-19 that you as a doctor have mostly probably been privy to hear about. So if you can kind of shine a light on that.
Yeah. We've always had, when it comes to health, a lot of misinformation, miscommunication, right? I mean, people always, take another vaccine, the flu vaccine. There's a lot of, they give you the virus, it actually causes the flu. With the measles, we've seen a lot of pushback and stuff that's been totally scientific, disproven. But in COVID, I kind of call it as, misinformation on steroids. We've had major disinformation. And you could, increase the stress and the mental health when people hear these channels. There's been a deliberate attempts to miscommunicate for various agendas, things about masks, things about, I'll give you some of the examples I've heard in a second. But what's been really worrisome is that sometimes we see our government leaders being complicit in a lot of this information, masks being one of them. Masks don't work, you shouldn't wear masks. We see it both at the state and the federal level, and that really raises the anxiety. But yeah, Christina, I mean, I've heard tons, of crazy stories. Now with the COVID vaccine coming online, that's been the big one. But even before that, people were saying, don't wear masks. Masks have toxic chemicals that'll kill you, kind of things. And so you shouldn't wear masks. Masks deprive you of oxygen. It's going to make you really low. Stuff that really has no scientific basis. And I'm not sure what the agenda is of people spreading that kind of stuff, but we've seen the deadly effects from that. Mm-hmm. I've seen stuff about 5G towers, and I don't understand where this came from, that somehow the 5G, it was a conspiracy between the telecommunications company and the COVID military complex, and these 5G towers were a kill switch for the COVID virus. I don't understand the logic, but that's been really crazy. Now with the vaccines, we're hearing that what the government's doing is injecting nanoparticles, these microscopic robots to track your every move. Really crazy. I've heard stories with the 5G towers now with the vaccine that it's a way to get you to buy their products or something. Again, the logic of this is really crazy. But we do have a lot of really crazy. And so I could see, the regular person, it's already in a heightened state of anxiety and the stress over everything about COVID, the social isolation. And they read all this crazy stuff on the internet, on Facebook, and it really, heightens when we already have a lot of other reasons to distrust, right? I mean, the whole, racial issues over the summer, now with the elections. And so now this is on top. So hats out to people that can still stay sane in this really insane time. I mean, that's all I'm going to say about that.
Thank you, Dr. Carrasquillo. I had a question for you. If you could explain for us, what does it mean to be asymptomatic?
Yeah, so we know approximately 80% of the people with COVID do not have major symptoms. They have either no symptoms or mild symptoms, and that's 80% of the people. And, you know, a lot of us are healthy people and they're just what we call carriers. So they don't know they have the disease. So this is where mask wearing comes in really, really important. Many people don't know they have it, they're out about, but if you wear a mask, you prevent yourself from spreading it to other people. And so, yeah, a lot of people have this, so they'll just get, you know, low-grade fever, you know, some muscle pains, maybe a little bit of cold-like symptoms and nothing else. And so they don't really know that they're infected. So it's really important that all those people understand that we're all at risk of being these asymptomatic group that don't have the, you know, the more severe COVID symptoms.
And once you do have COVID, are you able to get it again? Is there, I've heard that there's like a time frame where you can't get it again. Can you shed some light on that?
And so, you know, after you have COVID, you develop antibodies. We don't know how protective they are. We know they last several months, and that most people that have COVID do not get it again right away. We don't know how long that protection is, but certainly there have been many cases. We've had cases here where people have gotten COVID again, where they had COVID early on, you know, in March. It cleared. They were then COVID negative and everything else, and then they come back to COVID with another case of COVID. So you can get it again. It's uncommon to get it, you know, shortly after, but it can happen. And we've certainly seen cases from early on in the epidemic, people getting it again. So
yeah, there's always those odd cases, right? That,
yep.
you know, that's why just to bring it back, precision medicine, you know, that's everybody's different, everybody's unique. So it's important to understand that, right?
I'm glad you looped it back to precision medicine, because that's where research is really important. You know, what are the risk factors that make people redevelop COVID? Again, it's a rare thing, but, you know, is it something genetic? Is it something in the environment? You know, what is it? So these are all important things that, you know, research will be able to answer, but which we don't have good answers right now.
Right.
So with the large number of people that are asymptomatic, when should a person be tested, and why is it important to get tested?
Well, I mean, certainly anyone that has any symptoms should definitely be tested, because if you're tested, you know, you have to quarantine yourself and avoid contacts. You know, the number of days before was 2 weeks. Now, if you're fine, you know, within 10 days, your symptoms have gone away, you know, for at least 48 hours, you can go back, and it keeps changing. But it's really important if you have any mild symptom to be tested. People that are asymptomatic usually want to get tested. For example, over Thanksgiving, we saw a humongous peak in people wanting to be tested because their grandparents were going to come or something like that. They wanted to make sure. The problem with that is that, you know, you don't exactly know, you know, maybe negative today, but then you're exposed to somebody and you're going to get it again. So when to be tested, I tell people, if you have any symptoms, are clearly very important. Big steps you take are negative. But we also have people that want to keep testing themselves every week, and that's probably overkill. Certainly for our college students, we test them periodically because they're in a setting where they can spread it very quickly. So there's no hard guidelines about how often or when you should be tested, but clearly if you have symptoms, it's critically important you go out and get yourself tested.
Great. Dr. Carrasquillo, can you talk to us a little bit about how COVID-19 has disproportionately impacted communities of color?
Yeah, and so we're seeing that tremendously, you know, both nationally and here in Florida as well, and in the county, for many reasons. You know, we don't know if there's any genetic reasons. Programs like All of Us will help that, but we do know that there's many other reasons why minorities are affected. First of all, the jobs. You know, minorities are much more likely to be essential health workers and have the type of jobs where you have to keep going to work. Clearly, you know, since I'm in healthcare, you know, people like the housekeeping staff, for example, nurses, assistants, and things like that, minorities much more likely to be in the healthcare field, and that's one area. But in many other things, in public transportation, government jobs, public sector jobs are another area. So they're much more likely, also more likely to live in houses with more people, you know, just the density of extended families, and also the neighborhoods much more likely to live in the more urban environments with a lot more people around. So there's many factors, also more likely to have some of the risk factors for COVID, like diabetes and other chronic comorbidities. So there's many reasons why minorities are, just from, you know, other things that make them at higher risk of developing the illness. So that's why a lot of our initiatives here focus on educating, particularly people from minority communities around COVID, and on preventing them from being victim to a lot of the misinformation that's being sowed out there.
So we have heard about the economic and physical disruptions. Part of the reason that we're here today is I want to get your opinion on why you think mental health during this pandemic is so important.
Yeah, and it's been, I mean, it's one of the things we see repeatedly in the clinic. I mean, could you imagine, you know, when hospitals, I know one of our major hospitals, Jackson, went back to no visitor policies. Imagine a family member admitted for COVID. One, the family can't go visit him. And now the person themselves are in the hospital and they can't get visits. So that's one very dramatic example. But the biggest impact has been out in the community. People, you know, the social isolation measures, particularly for the elderly, but for everyone. I mean, we are social people. We depend on contact with lots of people. Imagine being told we need to limit this. You can no longer have the parties and a lot of the social activities, the stuff, you know, you guys are doing, right? With a lot of your events before. I mean, those were tremendous mental health interventions to help people with cultural activities, sports activities. I mean, you know, we used to tell our people, you know, mental health, we have really, really good data that doing regular exercise works just as good, as not better than pills, for example, right? So a lot of those things that was critically important, we had to curtail that. So add that already that we no longer can do that on top of all the additional stress and additional misinformation, lack of knowledge that came out. And again, we have a recipe for major, major mental health, and we're certainly seeing that in our patients. You know, a lot, the amount of mental health symptoms has gone on dramatically due to COVID.
I really like what you said just about exercise. You know, I think during this time, it's so important. You know, a lot of us are working from home and, you know, we've lost that structure in our day and there's no separation between work and home. So I think to go off what you said, something that's helped me, for instance, is kind of keeping that structure. And even though it sucks getting up at 5:30 a.m., you know, or 6 a.m., but to continue, you know, working out and doing that 40 plus minutes of exercise really has helped me that, okay, now I've started the day, now I can conquer it. You know, and I really feel like that helps kind of distinguish, you know, the differences between being stuck at home for, you know, just waking up and going to your computer rather than starting your day in a positive way.
Yeah, that's so important. You know, one of our staff the other day just told me, I don't work at home. What I ended up doing was now I live at work. You know? I mean, that was a very sad comment, I think. And again, you know, hats off to Nick. Exercise really important. And I tell everyone, you know, at least 5 days, you know, we got to hit those 300 or 360 minutes a week. But there's many other things we can do aside from exercise. And I know, you know, Sunny Isles promotes a lot of this, yoga, meditation. There's many other things, you know, I wish everyone could run a certain number of minutes every day, but there's many other things. Focus on cultural and other activities, anything that to keep you healthy, you know, try to do things that you enjoy and make specific time for it. I know it's really hard. You know, I'm almost embarrassed to tell Nick, but, you know, I haven't been going to the gym like I used to. I mean, it's just, you know, our gym was closed for a long time and now, you know, there's very strict rules about making appointments and everything. And I've been doing a lot less exercise. I've certainly been a victim of that. And, you know, it was really good for me before. But a lot of these other activities that we used to do, you know, these cultural things, these events, you know, our art events that were canceled. I mean, that was really sad. So trying to find something like that. You know, some people certainly need medications, but there's a lot of non-medical things we can also do for mental health.
Yeah, agreed. And I think you can definitely start with the alternatives first and then, you know, progress to if it's, you know, then you go the second route. But
Absolutely.
And even on medication, definitely to try all these as well to boost the serotonin and, you know, stuff like that as well.
Dr. Carrasquillo, so since you haven't been hitting the gym as much, how did you go about combating mental stress while you've been working on the front lines of all of this for the past, you know, 6-9 months with the pandemic?
Yeah, and that's not just me personally, it's all of our doctors. I mean, think about the healthcare workers, the nurses in the intensive care units. I mean, and seeing this every day. You know, really tragic stories unfolding before you. I mean, in July, when I was at Jackson, you know, we had a lot of very young people admitted really, really with severe disease that they couldn't breathe. And that was really sad. And it's really hard, I think. So we try to, for our faculty, I mean, we've had wellness programs initiated specifically to address this. We've done a lot of talks to the faculty about a lot of these mental health, what are the symptoms? what are the things, or specific examples, and provided, some programs that exist out there that they could do, and, very detailed tip sheets. And I'm hoping all the cities and municipalities are also doing that for their employees. That's critically important, to provide specific ideas and outlets to do that. It is really hard. I mean, these 12, 14-hour days we're all working really take a toll. I mean, I tell my wife, my family, the happiest days for me are on the weekends when I get to run for an hour, go out there and have a good run. And now that the weather's getting better, it's much easier to have those hour runs outside. And that's still very positive. But trying to take time, with your family, critically important. For me, that helps a lot, blocking out time to specifically be in the family and not be on the phone every second of the day, trying to catch up on all the things that are going on. So everyone has to find some way to decompress. It's hard. Trust me, I can tell you it's hard. You have to do it. If not, it's going to get overwhelming.
That honestly should be a rule, that when you're done your day, like a robot or something comes and takes your phone and you have to spend, 20 minutes of decompressing. Like that's such a good thing you
so
just
for the residents, these are young doctors in training. It's, as mandatory as you can make that, but it is mandatory
Yeah.
that they have to unplug every day for a certain amount of time.
Yeah.
So you mentioned a couple of things that would benefit some people, exercise and meditation being two of those.
Mm-hmm.
Is there anything else, maybe like nutrition or other things that people can focus on?
And again, I don't want, but even simple stuff, TV. I know we always say, get off the couch, don't be a couch. Some people watch it. If you have a favorite show from many years ago, go watch it. I'm almost embarrassed to say, but something that's been helping me is watch some of the old Star Wars movies, and also now the X-Men cartoons.
Oh my God.
Greatly enjoy that, so, it doesn't have to be that. I think many people forget about the critical role of nutrition. That's a founding for mental health, eating right during this time is clearly, we do see a lot of junk food binging. That's been dangerous. So combine that with the lack of exercise, clearly the weight gain we're seeing. Increasing, the amount of fruit and vegetables is critically important. We as doctors no longer try to be very prescriptive about this is what you have to eat and this is what you can't eat. Obviously, our nutrition advice now is try to limit the bad foods to the smallest amount possible, but don't eliminate it all. And much more of the nutrition is just increasing your overall fruit and vegetable intake. That's clearly, I mean, we see a lot of positive effects from these things. But yeah, the junk food binging has really, really concerned us, from weight, from blood pressure, from diabetes. And clearly good nutrition is critically important, as well as, the hydration issue, drinking water, the amount of water you have to drink, that's also critically important. So it's all part, but general nutrition, I think, is been somewhat underappreciated, the problems that has led with the junk food binging.
Yeah, it's one huge circle, right? The healthier you eat, the more motivated you will be to exercise. You exercise, you drink water, it's just one big circle that as long as you can master one of them, then, you can start to work on the other ones as well.
Yeah, I found that the most important thing with nutrition is finding something that's sustainable, not militarizing your diet, because then you're never going to stick with it. But I don't know, maybe do you agree with that? Yeah,
no, you're absolutely on track, right? So, and this is pre-COVID, right? Just COVID has made everything worse. I mean, pre-COVID, it's really sad. You would see people go on these crazy diets that you knew they couldn't maintain, right? And so they totally change it. They lose, sometimes 20, 30 pounds. They're all happy. But a year later, it's stuff that they couldn't sustain. And so they stopped and they gained oftentimes even more weight than they lost. And that yo-yoing weight is really dangerous. So yeah, it's got to be something that you're committed to the long term. If these are foods or things that are not normal for you and that you don't normally eat, it's going to be really hard to change, to do a total change like that. It's got to be, we tell people a lot about cultural diets. Every culture has lots of healthy foods. So focusing on things you already eat and that are normal to you and increasing those and decreasing the ones that are not as healthy. And that's the general approach that we like to use rather than giving people stuff that they've never done before.
Yeah, there was one I saw online that it was like you can only eat potatoes for a week. Like you can boil it, you can eat it raw. Like that was it. And I was like, I don't know who in their right mind would try that. Like,
I don't know how much nutrition education you do, Nick, but I mean, I've seen a lot of crazy stuff out there. I mean, if you talk about a field that's rife with misinformation, miscommunication, again, pre-COVID, COVID has just made it much worse, but it has been nutrition.
yeah, I can see that.
It's tough to stay disciplined in times like this. So
Yeah, because you're always wanting to snack. Like you're sitting at your desk at home, and the cupboard's like right 2 centimeters away. Like you wanna go there and eat something. It's easy. So I'm guilty. I'm totally guilty of it.
Yeah, I think the hardest part is taking that first step. Like, you know, how you mentioned, it's all cyclical, right? Like once you start eating a little bit healthier, it's a little bit easier to do some exercise and it's a little bit easier to drink more water. But taking that initial step is really, really hard. Something, and I am not a good example of staying, you know, physically healthy during these times. It's been really easy to fall in that junk food train. Working from home, I have a daughter who's also been putting on some weight during this time because, you know, staying home and not doing the same structure. Something that I've tried to do, and even that I'm struggling with, but like a little step. We have a dog, but I have a backyard. So usually we just let the dog out in the backyard. So I've committed with my daughter, we're going to take a walk every day. And every day we try to walk him a little bit further and, you know, just go a little bit longer so we get a little bit of time in there outside.
I think your message, we're all in this together, is critically important for people to understand that it's not just them, that where everyone is struggling. I mean, from a mental health perspective, there's so much stigma around it. And no, this affects everybody. And, you know, appreciating that, you know, we're all in the same boat and that this affects everybody. A lot of people with more, you know, severe forms of mental illness appreciate knowing that we all struggle with these issues, that they're not somehow different, or, you know, a lot of times we stigmatize these things, and that's, you know, farthest from the truth. So I think those kind of messages, letting people know this, that, you know, we all struggle with these issues, you know, is important for people to understand.
Yeah, I totally agree. And Sylvia, just going back to your part, you know, I read in a book once that it takes 30 days to form a habit. Now, Dr. Carrasquillo, I could be way out to lunch saying that, but within those 30 days, if you stay consistent and you do it every single day, no matter if it's, okay, I'm going to set a goal of drinking half a gallon of water every day, and you do it consistently for 30 days, it becomes almost natural after that, because it's almost like muscle memory. Like, okay, now I'm going to remember to go do that. Now I have to do it. Okay, I like the way I feel when I do it, so I might as well continue to do it. So as long as people can stay 30 days, you know, as a goal, then it almost becomes like, you know.
Yeah, we tell people, you know, different strategies work for different people. So if you came to see me as a patient, Christina, that's working for you, and that's great. You know, everyone has to find what works for them and how to get there.
Yeah, that's very true.
And that's what we, you know, we try not to overprescribe to a certain group, but whatever people, you know how they can get there, and they need to, you know, it's all about you know, we call it motivational interviewing. It's all about getting them there in ways that work well for them.
Yeah, and everybody responds differently to motivation.
So going back a little bit to the hospital and you know, when you had patients who were sick and the family members couldn't be with them, and you know, there's a lot of people experiencing struggles with that. What did your team do, or what ways have you found to motivate the family members to try to get through those difficult times when they aren't able to be close with each other?
Again, it's one of the saddest people. And again, I was just in the hospital, in the regular, in the non-COVID unit this time. And it was really sad to go back to that no visitor allowed policy, because we're back to one. And so, you know, there's certain guidelines. So the nurses have to call the family every day, keep them updated what's going on. We've done a lot with the Zoom. I mean, Zoom is just, you know, Zoom is great. I'm glad we have it, but it doesn't substitute for the face-to-face interaction, unfortunately. So we try to put Zoom, those that don't have it, you know, there are, you know, iPads, you know, or these type of devices that we use for the patients. And so now on rounds, you see the residents, when they're seeing the patient, they do the call with the little phone and contact the family, and the person's there. So you try to do a lot of that and try to keep it, but it's still having a family member there has such a soothing effect on patients. Just knowing that they're sitting there. Plus, they can advocate. The patients sometimes they're not good about expressing what they need, and the family members are there to sort of serve as a watch and a check to make sure that their family members are getting good care. So it's a challenge. And you can imagine, we work in a hospital. Imagine the nursing homes.
Yeah.
And family just couldn't keep up with the uptake of somebody who's elderly and had a lot of chronic illnesses, but they would still visit them regularly. And then that's not happening. So it's up at many levels. It's really sad. So we try, but we all recognize, we all want to go back to the way things used to be. And we have to do it. And we have to do it. I mean, we see our positivity rates, hovering around the 10% level. You can't let people come to the hospital. We have very, very sick people, patients with advanced illness. The last thing you want is a COVID, hotspot because we let people from the outside come in. So it has to be done, but we recognize a lot of the negative impacts of that.
Yeah, so inside the hospital, I can imagine that's extremely difficult, not being able to see family. And also for those outside that have plans for the holidays, that generally go and see family during this time, whether it's Christmas or Thanksgiving, not being able to do that. Do you have any advice for how people can get through those times?
I've done a lot, obviously, we're all social. All cultural groups are highly social. My own bias is that Latinos are especially social. So you could imagine having to, Thanksgiving without the big family gatherings. My mom, she lives in New York. She definitely wanted to come and be with the family. My sister was going to come down for Orlando. We had this whole big thing, we're over this as planned, and we had to cancel it. And the holidays, unfortunately, are going to be the same. Those big events. Well, Christina, you may not know. You haven't been working with me. The highlight of my life every year was the big division party we would have at my house. We would have over 100 people, a humongous mega party for my staff. The usual Latino party, lots of food. Lots of, I would say, alcohol. I don't want to say it was too much, but there was certainly a lot of that at the party. And, we had to cancel that. That was the highlight. And I had to tell my family, my faculty and my staff, unfortunately, we can't do that this year.
Yeah.
And, people trying to be creative, Zoom, Kris Kringle and all this, that doesn't substitute, unfortunately. So Christmas is going to be really hard for a lot of us because that's not going to happen. But I think telling people that next year it'll be totally different, hopefully most people, which we should talk about, will be vaccinated, I'm hoping, and we can have these events again. But yeah, this Christmas, unfortunately, we do have to limit, and it's really sad because we're already seeing them again happening. A lot of people are moving forward with large social gatherings, and that's going to be really dangerous. When you have that kind of positivity rate, you really can't be doing that.
Yeah, just even my parents and my family's from Toronto, Canada, and in order to go to Canada, you have to 2-week quarantine prior to doing anything. So same thing. It's awful. You don't get to see family members or anything during the holidays. But I kind of just told them, you know what, this year's a write-off. This whole year's a write-off. This Christmas is a write-off. Let's look forward to next year. We'll plan for next year. So I can just imagine, for those who have no family around, how hard it can be.
Well, and talking a little bit, this goes beyond COVID, even prior to, people lose loved ones. But for those who've lost loved ones due to COVID, and so we're going to be, dealing with these upcoming holidays, thinking about that loss. We've talked about, nutrition and exercise. Are there any suggestions or techniques or strategies that you would give to help those people manage the depression and the sadness that might come about during these holidays?
Yeah, bereavement, and that's an area I don't think we've done well enough in terms of bereavement and support services for those. There are bereavement programs. I know we have one in our hospital. Our cancer center has a really good bereavement program, but grief is always hard. But if you compound that without actually have been able to see the person in the hospital, and then, you know, the big funerals people used to have or something is sort of like the last stage, and now that's no longer available. These are all really, really hard. So there are traditional bereavement programs. The problem is that now, you know, we can't do a lot of these traditionally. So you have to go through Zoom and things like that. It's no substitute. But that is one area where I think being exceptionally neglected has been the mental health impacts on bereavement. And I'm not sure how good these online programs are, you know, as a substitute.
So we talked about, again, what Silvia just mentioned, all the things that people could be doing right now: exercise, taking walks, you know, mental clarity, meditation, nutrition, all of that. For people on a normal day-to-day basis, none of that actually is possible if you're not motivated to actually get up and do those types of things. What do you say to people that just lack the, you know, and this might be outside of COVID times too, just lacking in motivation? What can you tell those people?
For those that have, that's where friends and family come in, right? And maintaining your social networks. They're the ones that help you through these times, right? And it has to be virtual, but, you know, that's where friends and family. The challenge is the ones that are more socially isolated. And that's where, you know, reach out. You've seen a lot of these campaigns and, you know, encouraging all municipalities to encourage them to reach out to people that you may not normally reach out to, see how they're doing. You know, that second cousin you haven't heard from in a while that doesn't really have many people. You know, a neighbor, hey, look, let's chat over, you know, use my number, let's chat, or something like that. So trying to get those that are more engaged to engage with those that are less engaged. And I'm hoping a lot of the, you know, people can sponsor and support those kind of initiatives.
Yeah, that's a great. You know, when you're struggling, sometimes it's easy to lose sight of others, and sometimes a good way to handle that is to reach out to somebody and help somebody else, and that will almost make you feel better because you're helping someone else with their mental clarity, and, you know, and gives yourself a chance to also discuss too. So I really like that, and I think that's a really good point for sure.
So you talked initially a little bit about some of the programs in the hospital and, you know, giving out tips for what to look for how, you know, if you're stressed or, you know, you need to look for some possible solutions and techniques. Do you have any of those that you could share with us now, what to look for to know that you're possibly suffering from some stress and needing to really pay attention to your mental health?
Yeah, sure. I just had the list. It was probably, Christina's actually in our list. You know, I don't know if you've done the latest annual training. It's part of our annual training, but what to look for. But clearly changes in behavior, work patterns are one of the, you know, obviously red flags that we always look for. You know, people suddenly acting very differently, doing things differently, or, you know, when you see their work performance drop precipitously. You know, for our doctors, we check, you know, doctors that normally had high patient satisfaction ratings, and you start getting a lot of complaints from their patients, you know, that are totally, you know, not their pattern for them. Doctors that are starting to cancel a lot of clinic sessions that, you know, they normally wouldn't, is another example. We do spot checks on medical records, and you see, you know, hey, your notes used to be really good, now they're not. What's going on there? So there are ways to monitor work performance patterns and see what's happening. So from a workplace, you know, you have a little bit of more oversight and everything. It's harder for people that are not as engaged or something like that. You know, people that stop coming to meetings, you know, there's certain meetings that you have to be at. And hey, I have noticed you haven't been coming to my staff meetings, you know, even though they're online. What's going on and things like that. So you can pick up red flags at work. Certainly behavioral issues, you know, somebody, you know, suddenly starts, you know, acting a bit differently in terms of what they say and how they talk and how they present, and clearly you can see it. From patients, it's a little bit different. I mean, you know, we are seeing a lot of this, you know, where they stop taking their medications, you know, somebody that was really adherent to their medications, and suddenly, you know, you see their sugars go up, and turns out they stop taking their insulin, or they're just not taking it. Their cholesterol suddenly shot up, and you ask them, and yeah, I really stopped, you know. So there are hints you can get in people, but, you know, that's where, more professional people can be really good about diagnosing those things. But there are hints that, we track and we monitor.
Okay, very good.
Right on. So we generally perceive stress as a negative. Obviously, it's one of the things that we try to limit most in our lives. But is there any situations in which you could think about it in a positive way, like positive stress?
I don't know. I mean, my wife will tell you I thrive on stress. She said if I didn't have stress in my life, I would be the most unhappy person. So stress can be motivating if managed appropriately, right? And it is, sometimes it's not clear where that line is, where there's too much stress. But obviously, stress motivates. I mean, you do sports. I mean, clearly for athletes, it's a major motivation, right, to get and to do things. So there is positive stress, obviously. Our concern is, how people manage and deal with stress. And there's good stress and then there's bad stress. I mean, bad stress is all the misinformation and miscommunication, the stuff that people, should I get the vaccine or am I really concerned about the 5G towers, So there's positive causes of stress, you have to get a lot more done. We have a big vaccine trial, getting everyone enrolled, making sure we meet our enrollment targets and trying to make sure we do it in a very highly ethical manner and following all the appropriate protocols. That's positive stress, right? I mean, some people can deal with that, but then there's a lot of things that are happening out there that, are really no need to stress people with. That's the parts I worry about more.
Yeah,
Can we talk about that for a little bit? Sorry, Christina.
No. I was just going to make a quick comment that I think you're right that there's that defining line, but stress can be motivating. But it depends on what the situation is, where the stress level is, and then ideally how you deal with it, right? So for me, I even college students, I think a little bit of stress is good for them for, the last minute, I got to get the paper in or anything like that. So I think stress is good in our life. And it also teaches us how to handle life and realize that life doesn't always go our way for anybody, right? So I think that's a very important thing, is that we're not in this alone. Everybody is very much the same, that life is going to throw curveballs and the whole world is experiencing a curveball right now. So that's a very good point.
Yeah, I definitely think you need to maintain a certain balance of stress where it's not overwhelming, but it is, challenging enough. But you mentioned a few things about vaccinations and something that I'm dealing with personally in the realm of sports and, getting back to it and a return to play and the prospect of a vaccine on the horizon. And I know you're working on the front lines of this. But a lot of what I'm hearing from people is that they're going to wait to get vaccinated because they're unsure of, number one, its efficacy. Number two, the long-term side effects that people don't feel has been tested. Do you have things that you can mention about?
Yep. I obviously that's it. One of our doctors just told me that they surveyed. They do one of the units where they do, tests on people, invasive tests on people, and half the workers there said they wouldn't get the vaccine, and these are healthcare workers. So it's really, there's a lot of, I think, concern and misinformation. Look, I'm running one of the vaccine trials, and I could tell you the amount of data I have to collect from each participant, the electronic diaries. And if you don't put something in, we call you up and say, look, it's really important. We have a ton of side effect information on this. It looks for, at least for our, the side effects I'm reporting every day because I got to sign off on every single side effect that somebody has. They seem to be mild and tolerable. I'm hearing that for some of the messenger RNA vaccines, there's more incidents of allergic reactions, but they're mild. There's also been, more flu-like symptoms and things like that. But again, tolerable and, acceptable things. Like everything, we don't know. I agree. We don't know the long-term impacts, but I can tell you, we certainly know what happens when people get COVID. And we certainly know what happens when elderly and high-risk people get COVID. And, it's much like the flu vaccine. What I'm hearing a lot of people saying, it's, with the flu vaccines, people just have these notions about the flu vaccines that are not real. And, they have elderly parents or they have young kids, somebody just had a kid and the kid is 2 months old, but they don't, they're whatever, her brother-in-law doesn't want to get the vaccine. I don't care if I spread it to him or not. I'm just not going to get it. And with COVID, the reason I'm going to be first in line, I signed up, obviously frontline healthcare worker. I signed up immediately for when it's available. I do want to protect myself, but much more importantly, I want to protect my patients. I want to protect my mom. I want to protect my family members. For me, the benefits I can give and not spreading the vaccine to other people is much more important. And that's how I size it. At the end of the day, I would feel absolutely horrible if I caught the virus and then I gave it to my mom, sometime next year, if I didn't vaccinate myself when I do want to see her. So for me, it's all about the other people. While it's nice, I may be protected and that's great. It's much more about protecting everyone else. And so it's a hard calculus. I understand, so far, all we have is short-term data and people are absolutely true. It looks very positive. The side effect profile does not appear to be bad. And it's highly protective, at least in the first few months after the vaccines are out. And we're going to follow people for years and continue doing research, In our trial, they can be followed up to 2 years, for example. And we're getting detailed blood markers every few months on these people to track all these things. So at the end of the time, we're doing our best as we can to try document all these things and know all these things. I can't assure you 100% that a few years from now, something unexpected will not come out. But I can tell you right now, the horrors of COVID, I see them every day in the hospital. And we need to balance that because that's real reality that exists right now.
Yeah, I think we need to combat the misinformation with good information.
Yeah.
That's got to be at the forefront.
And some of that, and I'm looking, part of this initiative, we have a statewide coalition to address some of this miscommunication. We're looking for, people like you to help us. How do you address a lot of this misinformation? Because we don't know. A lot of this, it's an evolving science. It's misinformation and miscommunication on a level we've never dealt with it. And how do you address this stuff? How do you convince somebody who's absolutely convinced that there's nanoparticles and nanobots that are being injected, know that there's no nanoparticles, there's no microscopic robots that are going to be used to track you? How do you convince people that there's no kill switch on the 5G towers that somehow interacts with the vaccine? And for that, we need, our best solution is to have trusted community partners, community leaders, local governments that are much more trusted by people to lead in some of this. But we need a lot more solutions to address this. And we're looking for partners that can help us and tell us this is how you would, this is how you convince somebody that, there's no 5G kill switch, for example.
Very good. I am going to switch gears for just a second because we've actually received a few questions from the public. So I'm going to go into those and see if we can help answer these. So the first question that we received is about COVID testing centers. So actually what we're going to do for that, we'll share in the comments on the Facebook live stream a link to Miami-Dade County's website where they have, actually you can enter your location and it'll give you all of the testing centers near you to make that easy for you. Our second question.
The lines are getting longer at these testing centers. The amount of testing availability has expanded. Before, all we had were these testing centers. I know our health system now, we have a partnership with Walgreens where testing is being done there. The Quest labs are also developing other ways for people to be tested. So our testing capability initially was very limited by the availability of testing supplies. That's been done away with. Now, it's much more, and health system has much more capability to test people.
Okay, very good. This next question is, if one uses a mouth cover and wears glasses, can you get contaminated talking to an infected person? What can I do to relieve anxiety? I am 68 years old.
That's a good question. I've never heard that.
Yeah. So the issue being that with the glasses, the face cover is not a tight fit. Is that, I'm trying to tease it out. But I do know in the hospital, we do have to use face shields for the patients. So even in the non-COVID unit, when you see me, I have, It's like this big giant face shield. And I do have the N95 at the hospital. So we do use the N95 face shields. Even in the clinic, when we see patients, we're supposed to wear the face shield and the mask together to spread it. Most important, there's all these videos about how to properly wear a mask. You've seen the people, they only have their mouth and not their nose covered. And so it has to be a good fitting, seal up here. So if you have glasses, you have to make sure that it's sealed underneath your glasses and not above it. Because I could see, a lot of people making mistakes how to wear the mask. But if you wear the mask appropriately, again, remember the mask is not only to protect yourself, but protect others as well.
But like, let's say somebody else is infected and those particles, I don't know, go on the glasses. But you're wearing a mask properly. Is that of any danger?
That's what I didn't think about. I mean, we do, there's different face shields. There's a big giant one I wear, but there's also the glasses that people wear as part of the protective equipment. Mm-hmm. And I know those have to be sanitized. So after you go on rounds, you're wearing your gloves, your glasses, you do have to put, sanitize it with the wipe. We have these wipes, or just people putting on the actual alcohol solution all over it. So there's different ways, but you do have to sanitize that equipment when you finish rounding in the hospital.
So I'm guessing then same for those.
So that's what I'm saying, by applying it to glasses. If somebody's worried, they've been out all day, when they come home, they should sanitize their glasses just to make sure. It's what we do in the hospital.
That's a good one. Yeah.
I don't think that glasses are protective measures. If that's part of the question, whether or not glasses are going to be able to limit the spread onto yourself, then I don't know if that's.
Yeah, they're not safety goggles, correct? Yeah. So the question was, the safety goggles have certain seals above and below.
Right.
They have, the regular glasses don't have that. Yeah. So if somebody thought that.
Yeah.
And to her, well, his or her, I don't know, their comments about what can I do to relieve anxiety? We've talked a little bit about exercise and nutrition, perhaps just getting out for a walk, getting some fresh air every day, maybe in a park, an open space area that, you don't have to be worried that there's lots of people around you. Do you have any other suggestions for them?
Actually, I'll turn it back to you guys. What's Sunny Isles doing to helping, involved in community outreach and exercise? What is Sunny Isles doing around this area?
Nick, do you want to share about some of our SIB Healthy videos that are available on YouTube?
Yeah. No, this is actually something that I was very proud of the city for initiating fairly early, which was, we obviously couldn't do a lot of the in-person stuff. My programs, the sports programs, were severely limited. All of the senior exercise programs, which to me were of the utmost importance, which was keeping them active, at that stage in their life. So, moving everything to an online platform and having that information readily available. So whether it was the yoga classes or the strength training for seniors, we did some instructional videos for sports that kids could tune into and watch, and then go back later if they wanted to use those as resources, which is something that we can probably continue to do in the future too, as like a hybrid model if we do ever get back. But slowly trying to return to some activities while maintaining all CDC guidelines and paying attention to how we're trying to keep everybody safe. A phased approach to reopening the parks so that people have some space to get out there and do some activity, whether it's walk the trail or do some exercise on the fields while maintaining social distancing and those types of things. So mainly just access to a lot of the same things that we were doing before, but just, obviously we have to adapt and change a little bit, which I think has been effective. Obviously it's never going to be as effective as the normal times where everything is in person and we can see all of our friends and our sports teams and go to the park with several families. Right now that's just not possible, but definitely finding other ways to do that, which I think that the city has done a fairly good job at.
Awesome.
How about non-exercise cultural activities, Silvia? What are you guys doing in that area?
So currently we have limited events going on, obviously with the concerns and especially with the numbers going back up. But we do actually have, a couple of things that we've done and coming up this month, which could be a really nice opportunity. December 19th, we're doing a night of illumination at our Gateway Park. And it's by reservation, so it's free. Residents can reserve an appointment time. It's a 15-minute window, so that way we can monitor how many people are in the park at one time. And it'll just be an opportunity to get out, get some fresh air, walk through the park, see all of our holiday display. We have decorations up, lit decorations. We'll have some coffee and hot chocolate for sale. And it'll just be, a nice time to get out and get some fresh air with your close family and loved ones. So that you can check out our website if you're interested in participating in that. We hope you'll be able to make it. We're running December 19th from 6 p.m. to 9 p.m. So we have lots of time slots available if you're interested.
That's really great.
Nice plug.
Steve and I have been doing these, these talks with, several municipalities, and we're impressed by the amount of creativity that has gone on in doing some of this stuff. All the towns seem to get it and seem to be doing a lot of really positive stuff. So, it makes me really happy. Obviously, for employers are also doing that. The University of Miami keeps sending, online gallery shows with somebody talking, and then they show the things online. Have been a lot of music events and presenting stuff that normally would be in a concert hall and now doing it online. Everyone's figuring this out and trying to find ways. I do agree with Nick. These will never fully substitute for being there, but I'm so impressed with solutions people are coming up with. It's absolutely amazing.
Yeah, it's one of those, do you want to look at the glass half empty or half full? So you can look at it as like, we can't do what we've always known how to do. Oh my gosh, what do we do? Or you can look at it like, hey, you can start from scratch and create something completely new to what you've ever done before. How would you want this to look? So we're definitely trying to take the glass half full approach and make the best out of the situation.
Well,
Christina mentioned, go ahead.
Residents will definitely be benefiting from it. It's a sense of camaraderie and gives purpose for, just any type of activity. So I think it's very well done.
I mean, Christina and I work in the All of Us research program, right? And obviously we had to halt that, obviously, because what's going on. And, there's been a lot of creative thinking about how to do research in this new way. A lot of stuff about doing online enrollment, about doing some of the stuff ahead of time, many other ways doing, computer assisted interviewing, through distance. So there's been, everyone is thinking through. So I do think, initially there was a lot of stress and a lot of stuff about, oh my God, what are we going to do? It's also put out a lot of creativity juices. I think the people that are creative and can think outside the box and can think and can be innovative have really started to think through how to do a lot of this. And some of it has been positive. It's really made us think outside the box. And why did we always do things this way? Maybe there are better ways to do things. So, overall, 2020 has been a definite thumbs down, but I think some positive things have come out of rethinking the way we do things. And people got to take pride in joy in that, that it's pushed me a little bit outside my comfort box. And from a mental health perspective, those small wins are important for one to focus on.
Yeah. Great. I have two more questions that we got from the public, so I'm going to try to get those in. This one is a little bit of a long one. Bear with me, and I'll kind of summarize at the end. So this question says, my neighbors on both sides of my patio smoke cigars and cigarettes. I feel like I am in a prison because I want fresh air in the evening, opening up windows, but I get their smoke. I get asthma sometimes and feel their nasty habits are hurting me, probably their own health, and other non-smokers who go on their patios or open windows and get the toxic fumes into their condos. I've discussed that with one of the cigarette smokers. He said he can never quit. The other is somewhat considerate by trying to go inside or not smoke when he sees me come out. I'm hardly on my patio at all because I have to handle my own errands, etc. My husband is in a health facility. This is completely stressful to my sanity. I'm nervous, depressed enough from COVID. and wondering if there could be a minimal amount of time these contributors of toxic fuels can be on their patios. Probably no laws, right? But I feel it is a serious injustice for people like me that are practicing all the necessary instructions by CDC, and my building masks must be worn on the premises at all times. Many people don't follow that either. I can't be a police person, but I'm annoyed how persons' behaviors are during this pandemic. Any suggestions, please? So I will start off by saying I don't think that it's possible to control how much time someone spends out on their balcony or whether they're smoking or not. But I will look into that with the city just to verify, and I can reach out to this person directly with that information. But as far as the anxiety and the stress from all of this, I think we've definitely spoken about making sure to get some time, dedicate, even if it's a few minutes every day, getting outside. So if that means leaving the building and going for a walk in the park, going for a walk down the beach, just different ways like that, so they can be in an open space where they don't have to worry about being impacted by other people's behaviors. Do you guys have any other comments you want to add on to that question?
Yeah, I agree. I think, just making time for yourself, if that's an area that makes you anxious and, going outside, then and try your best to find an alternative. And like you said, maybe getting the fresh air outside, going for a walk, that will probably alleviate stress right there.
And just, again, not to, but we do know secondhand smoke, just as the person said, it's a real danger. And,
Yeah.
Absolutely. It is something to be concerned about. It's a policy. I don't know where the condo association lands on all these issues, but certainly I would encourage a person to avoid exposure to secondhand smoke. If it means, not going on the balcony when somebody else is smoking next door and, going outside somewhere else, some of the ideas. But certainly as a doctor, we strongly encourage people to avoid secondhand smoke. That is absolutely correct.
Well, and I just thought about this, but maybe they can put a fan on their balcony, and so that, any smoke that's coming onto their balcony, it's faced and going out. I don't know if that will really help, but I do know some smokers in my life, and sometimes when I have to be around them, I do that. So. Okay, I hope that was helpful. So our last question on Facebook, actually. So UK has dispensed a vaccination, and now here in Canada, there will be administered 250,000 doses for frontline workers. Where does USA stand in receiving their portion? Is there a second wave coming as they predict in 10 years? Hopefully, Dr. Carrasquillo.
Yeah, I'm not privy to 10-year up. I haven't heard that one. What's going to happen 10 years out? We don't even know how often, people will need more than one vaccination. The Janssen trial we're doing right now is with one shot. The Pfizer and Moderna vaccines is 2 shots. So I guess the question is where we are right now. So today, the FDA is hearing emergency use authorization for the Pfizer vaccine. And I think next week, Moderna, or the week after, the Moderna vaccine. The Janssen vaccine that we're working on, the study's wrapping up in the next few weeks. And they hope to have their data presented to the FDA sometime towards the middle or late January for that vaccine. Clearly, one company, we do know Pfizer has made it clear they do not have enough vaccines to vaccinate the world. Moderna vaccine is probably not going to be enough. We were on a call with Tony Fauci 2 weeks ago, and he was telling us with the vaccine that Janssen is working on, it doesn't need to be refrigerated as much as the Pfizer vaccine. It's much lower, so it's much easier. It's 1-shot dose. But he's saying he's counting on that as well to vaccinate the country. The actual number of doses, I've heard many crazy estimates all over how many doses will actually be immediately available. One rumor I'm hearing is that for Pfizer, maybe 2 million may be coming to Florida. But as you heard, whatever the number of doses are, first to be vaccinated are going to be people in institutionalized setting because they're at highest risk, and also frontline healthcare workers because we need them healthy and not spreading it from one patient to another. So those are the first few. The estimates I've heard is that by sometime by either the spring or the early summer, we'll have enough vaccines to do this. All the companies, some people ask me how do they do it so fast. One of the ways they did it is that normally when a vaccine is developed, you let the FDA look at the data, then people reanalyze and all this, and then you start making the vaccine. In this case, all the companies have been making the vaccine, which is why it undergoes emergency use authorization and approval, and within a couple of days, we'll start giving out the vaccine. We're working on the Janssen vaccine. We don't know if it works or not, but Janssen's been making the vaccine already for a few months in anticipation. So everyone's working really, really hard. We don't know exactly the dates. We don't know exactly the distribution, but we're certainly sure that by sometime this summer, we'll be able to vaccinate most people that want it. It is emergency authorization. It can't be mandatory. It's up to each person because we don't have the long-term data, but it is happening. And, so that's my best estimate without knowing, obviously, every day something else comes out, how it's going to be distributed, how exactly it's going to happen. All those details are still, being sorted out right now. So we don't have exact data on that, but we will.
Okay, very good. Fair enough. I'm just gonna get into this last portion here, and can we talk about how, you touched on this briefly, but can we talk about how the coronavirus has impacted the All of Us research program?
Christina?
Oh, you would like me?
Yeah.
Okay, absolutely. So the All of Us research program has, COVID-19 has been put, the research program on hold for a specific portion of the program. So usually there's a blood drawing sample that needs to be done as part of signing up to the program. So because of COVID-19, all our facilities have just been closed down for now. We're actually looking to reopen shortly. So you can still sign up online and contribute by doing online surveys, because that's a huge part of the program, is being able to take into consideration how you're feeling during COVID-19, mental health, all these kinds of things. So it all contributes to the overall research, and that kind of goes into line with your environment, your lifestyle, and your biology. So all these things add up. So right now we're still enrolling people and hoping that they go online and take a few minutes out of their day to do these surveys for us. But after, hopefully we'll be reopening soon. So with that being said, Dr. Carrasquillo, we can probably share this question. What are some of the benefits to enrolling in All of Us research? So if you want to start, I can finish it off, and then we'll, I think, call it pretty much. So
Sure.
why don't you?
Yeah, sorry, I was dealing with another acute issue, but the question was, how has this impacted all of us, and what was your question?
So my question is, what are some of the benefits for people when they enroll?
Yeah, so I think it's really important. One of the things COVID has done has made us repivot to a lot of our ongoing research into COVID research. Certainly, a lot of my research teams have been focused on the vaccine, but we do have to contribute to the greater good than we've been doing it. So part of returning to the new normal is like getting up the All of Us research study we started. I think a lot of my excitement around the All of Us study is the detail of data that we're going to be able to do. So it's going to be the nation's biggest database, 1 million people, but it's also going to have detailed genetic data, detailed hospital record data, detailed data on things that people report from their surveys about their lifestyles and things like that, plus a lot of environmental data that we'll be able to get from the neighborhood level on these people. So it's going to be probably the richest database that we have to generate research. So linking all these, the genes, the environment, lifestyle, behaviors, that's the holy grail of medical research, and understanding how these are related. I'm a bit optimistic. I kind of say that, before all this COVID hit, that the All of Us will basically inform medicine for the next 50 years. Some of us may not know, a long time ago, there was a heart study called the Framingham Heart Study that started in the late 70s. A lot of the information that we had about cardiovascular epidemiology, about blood pressure, cholesterol, and all these cardiac risk factors came about at that, what back then was a large study. Now doing all of us is an exactly small study, but a lot of major discoveries in heart disease came from that. And I think for general health, this is what all of us is going to be. It's going to inform major things about health that we don't know right now. The critically important thing is to make sure we have a diverse participation. We don't want, we really want the study to be representative of the US population. We need an adequate amount of minorities, of elderly people, of rural populations, of LGBT populations. We need them all adequately represented in the study, because then whatever we learn from it will be generalizable to the whole US population. So we're really looking forward. We've made plans to try to start it up again in January. We're in the process of submitting that. We know how to keep people safe. We know how to do a lot of these things in a safe manner now. And so we're really looking forward to that.
And something that's really exciting that I am so excited about is we've just started to return genetic results back to participants. So when you come and get your blood drawn and you give your DNA, we're actually returning genetic results and traits. So, questions like, do I drink soap, or why do I crave caffeine, or, why does cilantro taste like soap? There's a bunch of different characteristics that you'll find on your profile that once you give this DNA, you'll receive these results back, and you also get to see your genetic history. And then another thing is you can you'll receive results back about your I always struggle with
predisposition to certain.
Yes, thank you. I always struggle with that word. Diseases or illnesses or sicknesses that are within your family and your genetics. And, we have genetic counselors that are on board that if you have any questions, you can ask them about it and say, I have heart disease within my family. Like, is this something that I need to be worried about, or what can I take precautions? So there's a bunch of benefits along with contributing to this factor of knowing precision medicine and individualizing healthcare, because I cannot express enough that everybody's individual, right? And, Dr. Carrasquillo is different from me. We have different ancestry, different genetics, different, all the other stuff. So it just is completely different. And it's important that we get that diverse data for sure.
Thank you.
Okay.
People are excited. Yeah, people are excited about finding out about the, ancestry, for example. Obviously, a lot of people pay a lot of money for this. It'll be one of the things. But even the asparagus issue, how different people, how they can taste asparagus and whether it's bitter or not to them. I mean, I find some of this really fascinating. But yeah.
Do you have a lot of earwax is one of the questions. Like, there's a bunch of things and cool things that you can learn about yourself that I don't know if you care if there's a lot of earwax in your ears, but it's just an option.
So there's a lot of really important research that we need to get back and start doing. And we really look forward to in 2021 to get a lot of these projects up and running again. So.
Yeah, so to close off, All of Us research program is focused on improving healthcare. So as we talked about, and as we, spent this last hour, we recognize how important mental health is to all of us. And like I said before, we're all in this together, we're all struggling. So the All of Us research program strives to learn more about mental health and other health related conditions that Dr. Carrasquillo talked about. So for those who are tuning in or who have been tuned in, if you would like to learn more about the program for our specific site, the University of Miami, we encourage you to visit joinallofus.org, or you can directly call 305-243-8380. We're also very active on social media, so if you'd like to connect with us there, you're more than welcome. We're on Facebook, Twitter, Instagram, at All of Us UM.
Thank you, Christine. I do have to log off, but thank you so much.
Yeah, go ahead. I'll finish this off. Thank you so much.
It was a pleasure, Nick. It was a pleasure.
Thank you, Dr. Carrasquillo.
Bye. And so basically, I'm just going to say, if there's any other additional questions, please leave them in the comments. We'll absolutely answer them, either the team from Sunny Isles or I'll, answer questions. Thank you for joining. And like I said, we're all navigating through COVID-19 together. So stay healthy and happy holidays, everyone. Thanks.
Thank you, everyone. Thank you, Christina.
Thank you. Bye.